What if those little lapses in memory, like forgetting names, misplacing your keys, aren't just part of getting older? What if they're signs of something more serious like dementia? In this video, we'll show you how to tell the difference between normal memory loss and early warning signs of dementia. If you or someone you love is struggling with memory issues, stay with us to learn how to spot the signs and take the right steps to get help. Normal aging or early dementia. We all forget things now and then. Maybe you misplace your keys or forget an appointment. These little things are completely normal and happen to everyone, regardless of age. It's easy to brush them off as just part of getting older. Sometimes you might forget about a meeting and remember it later, or struggle to recall the name of someone you met once. These are common and usually not a sign of anything serious. However, persistent memory issues are different. When absent-mindedness becomes frequent and begins to interfere with daily life, it's a sign of something more serious. For instance, someone may often forget important details like the names of close family members or recent events. Over time, these memory difficulties can intensify and interfere with tasks like personal hygiene, preparing meals, or completing routine activities. The key difference is that while occasional amnesia is part of aging, when memory problems start disrupting daily routines, it's important to take notice. Repeatedly forgetting how to perform tasks or struggling to recognize familiar people or places are signs that require further evaluation. It's essential to understand that sometimes losing track of things isn't a sign of something serious. Stress, lack of sleep, and emotional fatigue can also contribute to forgetfulness. These factors can affect how well we remember things, especially during difficult or busy times. Early signs you shouldn't miss. The early signs of memory and behavior changes can be subtle and develop gradually, often making them hard to notice. While forgetting things occasionally is normal, frequent lapses, like forgetting recent events or important details, can start to interfere with daily life. Disorientation is another common sign. A person might get lost in familiar places, forget what day it is, or have trouble recognizing their surroundings, such as their own home or neighborhood. Concentration can also become challenging. Tasks that were once simple, like following a recipe or managing finances, may become confusing or overwhelming. Behavioral changes are often seen as well. Someone who was once social may start withdrawing from others, or they might experience sudden mood swings, becoming unusually suspicious or upset without any clear reason. A loss of interest in hobbies or activities is another red flag. The person may need encouragement to engage in things they once enjoyed, including basic tasks like getting dressed or maintaining personal hygiene. If you notice any of these signs in yourself or a family member, it's important to reach out to a medical professional. Prompt action can help manage symptoms and improve the quality of life for both the individual and their family. The warning signs of dementia. Noticing changes in memory or behavior can be concerning, but how do you know when it's more than just normal aging? Here are some key signs to watch for. If multiple signs are present, it's important to consult a specialist for a thorough evaluation. Memory loss is one of the most common signs. While occasional mind blank is normal, dementia-related memory loss often involves forgetting recent events, conversations, or appointments, which interfere with daily life. After the early signs of disorientation, routine disorientation often follows. This occurs when familiar tasks, like getting dressed or steps involved in brushing their teeth, become difficult to manage. The person may struggle to follow their usual daily schedule or sequence activities correctly. It's not due to physical limitations, but cognitive changes that disrupt memory and organization. Language difficulties are also common. Someone may struggle to find the right words, use incorrect terms, or have difficulty following or participating in conversations. Everyday tasks can become more challenging. People may forget steps involved in activities they once managed easily, such as cooking, paying bills, or driving. Tasks requiring planning and focus may overwhelm them. Impairments in abstract thinking can also develop. Managing finances or understanding basic numbers may become difficult. Poor judgment can show up as well, like making unsafe decisions or mistakes, such as wearing inappropriate clothing for the weather. Spatial difficulties often occur too. A person might struggle to judge distances or directions, which could affect their ability to drive or navigate spaces safely. Changes in mood or behavior are frequently seen. A person may become unusually suspicious, withdrawn, or overly outgoing, or experience rapid mood swings. If you notice these signs, it's important to seek help from a healthcare provider. Initial diagnosis can help manage symptoms, identify underlying causes, and offer the necessary treatment and support. What else can cause memory issues? Several conditions can cause symptoms similar to mental deterioration, but they don't always indicate something serious. Depression, for example, can cause memory glitches, fatigue, and social withdrawal, which may seem like memory problems. Fortunately, these symptoms often improve with treatment, such as therapy or medication. Infections like urinary tract infections can cause confusion, especially in older adults. Once treated, the confusion usually resolves. Vitamin deficiencies, particularly B12, can also affect memory and thinking, but are typically reversible with supplements. Thyroid imbalances, whether underactive or overactive, can lead to memory block, mood changes, and difficulty concentrating. These issues are often treatable with medication. Additionally, untreated sleep apnea can cause memory problems and difficulty focusing, but treatment usually brings improvement. The good news is that many of these conditions are treatable, and their symptoms can be reversed or managed with the right care. If you or a loved one is experiencing memory changes, it's important to consult a healthcare provider. They can identify the cause and guide you to the best treatment, offering clarity and reassurance. Diagnosis of dementia. An accurate diagnosis allows for better planning, access to appropriate treatments, and support. It also gives time to explore clinical trials or additional resources to help manage the condition. If you're noticing changes in memory, behavior, or mental capacity, it's important to consult a healthcare provider for an accurate diagnosis. Swift diagnosis provides clarity and helps determine the best course of treatment and support. The process usually starts with a review of your medical history. The doctor will ask about when the symptoms began, their progression, existing medical conditions, medications, family history, and lifestyle factors. This helps identify potential causes and rule out other conditions. Cognitive tests are commonly used to assess memory, attention, language, and problem-solving abilities. Brain imaging, like MRI or CT scans, may be recommended to detect structural changes in the brain, such as shrinkage or damage from previous strokes. Blood tests can identify issues like vitamin deficiencies or thyroid problems, which can impact brain function. In some cases, cerebrospinal fluid analysis may be used to detect specific biomarkers associated with conditions like Alzheimer's. New tests such as blood biomarkers and visual processing assessments are also emerging as useful for preliminary detection. An accurate diagnosis allows for better planning, access to treatments, and support. It also provides time to explore clinical trials or additional resources to help manage the condition and improve quality of life. When to get checked. As we've mentioned before, it can be hard to tell if forgetfulness is just part of getting older or something more serious. Speaking with a healthcare provider can clear up any doubts, help rule out other conditions, and open the door to treatments and support that might make a difference. Even if you're unsure, it's better to ask for help. A doctor can guide you through the next steps, give you peace of mind, and provide the resources you need. You don't have to face this alone. Taking action can improve quality of life and give you the support you deserve. Keeping your memory sharp. Taking care of your memory is easier than you might think. Regular physical activity like walking or swimming boosts blood flow to the brain, supporting memory and overall brain health. A healthy diet plays a key role too. Eating fruits, vegetables, lean proteins, and omega-3 rich fish helps keep your brain functioning well. Staying mentally active is just as important. Reading, puzzles, and learning new things can keep your brain engaged. Activities like crosswords, Sudoku, or new hobbies challenge your mind. Social interaction is also crucial. Spending time with loved ones provides both emotional support and mental stimulation. Lastly, cognitive exercises such as memory games or chess can improve focus and problem-solving skills. By adding these habits to your daily routine, you can protect your memory and improve brain health. It's never too late to start. Small changes now can make a big difference. It's completely normal to feel unsure or worried when dealing with memory changes, but recognizing the signs of dementia can help you take control. If you're concerned, don't hesitate to reach out to a medical expert. They can guide you through the next steps and provide the support you need. If you found this video helpful, please share it with others who might benefit from the information. Talking openly about health helps us all stay informed and supported. And don't forget to subscribe to our channel for more helpful insights. Your health matters, and we're here to support you every step of the way. Take care, and remember, early action can truly make a difference.